Yes, good morning, everyone. Hi, I'm Dr. Nitish Dogra from TARU, and that's a development sector advisory based out of New Delhi. And right at the outset, I'd like to say that we are fortunate in having with us here with us Air Vice Marshal Dr. Ajit Tyagi, former DG, former Director General of the India Meteorology Department. And I would like to, right at the outset, request him to make a few opening remarks regarding this very important area that we are having. Yeah, and before that, we'll have a recorded statement from Dr. John Balbus from the National Institutes of Health.
Good afternoon, everybody. On behalf of the National Institute of Environmental Health Sciences, and with a lot of gratitude to our host, TERI, and our knowledge partners, TARU Leading Edge, and the UCHAI, the Understanding Climate Health Associations in India initiative, it's my pleasure to welcome you to this webinar today, Building the Bridge Between Climate and Public Health. My name is John Balbus, and I'm a Senior Advisor for Public Health at the National Institute of Environmental Health Sciences in the United States, part of the National Institutes of Health. And I speak today in my roles as a Director of a collaborating center that we have at NIEHS, and also as the co-chair of a working group that we have in the United States on climate change and health under our Global Change Research Program. So it's really a pleasure to be with you today and to be able to introduce this important webinar that is aimed at introducing everybody to this intersection between climate, meteorology, and how those climate factors influence our health. For today's webinar, I want to emphasize three themes that we'll be seeing. They are collaboration, research translation, and capacity building. I'm part of a collaborating center and here in India today, and so collaboration is a key part of this, but it's not just collaboration between the countries or between different regions of the world. There's a very important collaboration that we're building here today, which is between the communities of public health and climatology and meteorology. There's been a lot of progress on this in India recently. The Indian Meteorological Department is building its own capacity to provide the kind of forecast products that we need in public health. And that's a very important kind of collaboration that we'll be speaking about today and talking about how do we build that, how do we really make that collaboration grow, how do we build that bridge. The second main theme is research translation. That's something that my collaborating center as part of a biomedical research institution is very interested in doing and something that I focus my attention on. How do we take the kind of research advances that we're having in climate change and health and translate that into effective public health action? Again, we have wonderful models for this in India. The work that's been done with the Ahmedabad Municipal Corporation and the early warning system there for heat is a great example of translating the research that we have on how heat affects health into effective interventions to protect people. As we build that research base, though, sometimes things get very complex. If we look at other kinds of diseases like dengue fever or malaria, even something like cholera, as we get more and more research, it gets more and more complex to understand exactly what are the relationships and what are the signals to be able to translate them into public health action. So as we'll talk today, we should be thinking about how do we balance scientific rigor as we're developing a greater understanding of these relationships with the kind of simplicity we need to be able to communicate to the public, to be able to translate these kinds of this knowledge into effective public health action. And then the third theme that we'll talk about is building capacity. Already, we see capacity growing within India, both in terms of the public health and the development of new institutions, the development of cells related to climate change and health in the National CDC and in the Department of Health, even in the Department of Science and Technology. And this is a wonderful development. This webinar is really meant to try to build on that kind of momentum. We know that public health people don't get trained in climatology and meteorology. Even environmental health people typically don't get trained on these kinds of disciplines. And we also know that meteorologists and climatologists have a lot to learn, and they don't get really trained on public health. And so part of this Building the Bridge webinar is aimed at building that kind of capacity, both in the world of meteorology and climatology to better understand how their work and their data can be used in public health. And then for the public health community, building that capacity to understand the nature of climatology and meteorologic forecasts, the medium-term forecasts that we're making more use of for early warning systems, and building that capacity to be able to use and interpret that data to be able to do assessments. And for all of us, the primary goal is protecting public health. So we have an excellent lineup of speakers today. I don't want to delay any further getting to that excellent lineup of speakers. Thank you all for joining the webinar today, and it's now my pleasure to turn the microphone over to our moderator for today's webinar.
Okay, so while that gets fixed, let's welcome Dr. Joy Schumacher-Guillemot from WMO, and just to give a very brief background, she was the lead author of the health thematic in the design of the global framework for climate services and the new WHO operational framework for climate resilient health systems. She has extensive field experience supporting public health and humanitarian programs across Africa, Asia, and Latin America. Her work focuses on translating climate science to public health action by building capacity to use climate-informed decision tools and risk assessments and to make better health planning decisions. So over to you, Dr. Joy.
Good morning, everyone. Excellent. Well, again, good morning to everyone, and thank you very much for inviting me to this fantastic session. I'm really glad to learn about the UCHI network and the activities that you're starting to embark on. So, as Dr. Dogra introduced, I work for both the World Health Organization and the World Meteorological Organization in a quite innovative and new initiative bringing together the climate and health sectors. So to go ahead, I will give you an overview of why climate services for health are a new and exciting opportunity for the health community, and then secondly, how the WHO and WMO partnership for climate services is trying to advance this space. So first of all, let's start with the problem. Our overall objective is that we're trying to figure out how to adapt the health sector and the activities that health professionals undertake to a changing climate. And to be able to do that, we really first need to start to understand what is the climate and what does it mean, particularly for health risks, health impacts, and health service deliveries. And critically, we need to understand when the climate is going to have certain influences, where these influences are going to take place. And that's all about then how do we use this knowledge to take specific action for preparedness and for health service delivery. So to frame that, looking at the operational framework for climate resilient health systems that Dr. Dogra also mentioned I've been a part of, this framework lays out 10 components of key activities that are really needed to holistically strengthen the capacity of a health service or the health system to become more agile and more prepared for the shocks and stresses that climate change and climate variability can bear on public health, be this in relation to air quality, extreme weather events, vector-borne diseases. This is a holistic set of activities. To zoom in on the green wedges on the right, this is all about generating and using the right kind of information to inform the management systems and the health programs that we're implementing. It's indicating that we need to undertake vulnerability and adaptation assessments, to establish integrated risk monitoring and early warning, as well as undertake climate and health research, which is all about, these are approaches to understanding that first problem. When is climate going to impact health? Where are these impacts going to take place? Who is going to be affected? But the gap here is that each of these information sources actually require information from outside the health sector. It requires tools and analyses that we as epidemiologists and public health professionals often don't have. And so the bottom line here is that to be able to generate and use the evidence that we as public health professionals need, we actually need to go outside our own domain to seek this information, understand this information, and start to apply it to health decision making. So what are climate services? Well, climate services can come in many different shapes and sizes, but they're best conceptualized really as partnerships, and the end-to-end process of that partnership that is bringing different sectors together to try and produce relevant information, making sure that it is authoritative, the information is on time when decisions need to use that information, and bringing together knowledge about future climate change, current climate variability, the past climate and how that influences the dynamics of risks such as vector-borne diseases. That is all about making this climate knowledge applicable to decision-making in sensitive sectors. So to unpack a little bit why we need these services, here's an example of climate information products that are often produced by meteorological partners. Now, the challenge is that these are very pretty images. However, without a partnership that can help access the right information, help translate what is in these images, how they were constructed, what the coding means, this information is not accessible and usable by the health community. And so we really need partnerships that are going to facilitate both the access and the translation of this relevant information. So what kind of information do the meteorological community provide? Well, they'll often be able to provide information about the weather, the short-term influence of climate that is packaged as weather alerts, extreme weather warnings, information about climate variability from the 2-week to several year period and how that is influencing the overall climate system. We've got seasonal outlooks, for example, seasonal forecasts that represent the kind of seasonal variability that's expected. And looking farther out into the future, the meteorological sector can tell us about what is going to happen far in the future, so decades and centuries, often packaged as climate scenarios and projections. Now, critically, the farther we move into the future, the greater uncertainty that exists in these products. And so public health professionals who are really focused on making sure we are using the best available evidence, understanding the skill, the precision, the uncertainty about these future climate products is really important. And so we need partnerships to make sure that there's transparency and understanding about the confidence intervals and the skill in some of these products. But then finally, even if we had a fantastic seasonal forecast, let's say, that's exactly going to tell us what will happen 3 months ahead, well, still that information isn't totally usable unless we, as health professionals, are involved to start coupling that with exposure information. Who is going to be exposed? Why are they vulnerable to, for example, extreme heat? It has to be blended with the vulnerability and exposure information to start to be a usable climate information product for the health sector. So here are just some examples of tailored climate information products that have been generated as the result of a partnership between the meteorological community and the health community. And just to take one of these examples down at the bottom left of the screen is a map of Montreal. And this is helping the health sector understand the daily influence of urban heat island effects. So they can monitor these risks geographically, understanding who is most exposed so that they can use that information to plan accordingly at the urban scale. Also in the top right, tailored product of daily heat information for elderly populations that's accompanied with a whole system of activities to make sure that this particularly vulnerable elderly population, this example from Hong Kong, are accessed and used by the people greatest at risk. So the process of getting from climate data to a useful and customized climate product is what we are calling a climate service. It is that whole partnership of bringing together the right expertise to identify the problem, identify the solution, build the capacity to develop that product, understand how it's going to be used, conduct research about either how the information is going to be applied, how communities may be receptive to extreme weather alerts, for example, research on the actual forecast products, making sure that we understand the sensitivities of the health impact we're concerned about and its relation to climate, and then applying these products. So it's an end-to-end process that we're talking about. The Director General of the World Health Organization has even recognized that climate services are going to be an essential part of how we adapt to climate change, and that they will be able to help us unlock some of this knowledge about the climate to really improve the core business of the health sector in detecting disease, monitoring health risks, anticipating problems, and taking more precise and targeted action that actually can save lives. So that moves me into why the World Health Organization decided to partner with the World Meteorological Organization exactly on this issue. And in 2014, the two institutions came together to establish this joint office for climate and health, which I lead. And together, both organizations are implementing the global framework for climate services, which I'll tell you about in a second. But we've come together to be able to activate and accelerate the use of climate and weather information specifically for health purposes. Now, the global framework for climate services is not only about using information for the health sector, but also in food and agriculture, disaster risk reduction, the water sector, as well as energy. And the framework is an international initiative with many partners, not only the WHO and WMO, with a formal governance process, many technical bodies that is really aiming over the next 10 years to try and activate science-based climate information for the sectors that really require it. And to paraphrase what this framework is about, it's helping to modernize national meteorological and hydrological services who represent the World Meteorological Organization at the national level. So in the case of India, this is the IMD. IMD are also playing an increasing regional role for climate and meteorological services, but it's helping to make sure that each Met service has the capacity it needs to observe the necessary conditions, be able to translate and produce products that can be usable by national partners. Secondly, this framework is helping to build capacity amongst the user community and create spaces and mechanisms for national, regional, and global dialogue with the health sector, with the water sector, about what kind of information we need and how it can be best deployed and used. And then thirdly, it's really helping Met services themselves internalize a user-driven service delivery model focused around these 5 sectors. So within health, several years of consultation and preparation for developing this joint initiative identified 5 priority areas of work that were really required to start to bring these sectors together. That we needed much more investment in capacity building, of how to use this information, how to generate it, that we need research on the influence of climate, how to use this knowledge appropriately. We need a wide range of partnerships. We need outreach, which is helping to raise awareness of the influence of climate, what we can do to better adapt and manage these risks, and that we need activities that are mainstreaming climate information and services like heat early warning systems into the routine operation of a health system. And so this manifests in a number of different activities that my office implements around the world in all regions, helping to support training programs, support to research and coordination around research, supporting networks such as UCHI on how do they better engage with the opportunities for climate information, how do they better engage with some of the regional climate outlooks that we're about to talk about. My office is developing publications and technical guidance to better explain what some of these climate services are, how they work, best practices about how they can be used. We will be launching a resource web portal in the next year that hopefully will also be a great support to networks such as yourself. And then we're supporting pilot projects in several regions of the world, notably in the African region as well as the Caribbean. So maybe I forgot to mention that this office was only established about 1.5 years ago. And so in 2014, we started this joint initiative, but over the next several years, what we're hoping, and these are the goals, that we're really aiming that this joint partnership between the two UN agencies will trickle down to the member states, to the ministries of health, to the national Met services, to ultimately result in improved availability of useful climate information and services, that we will be able to strengthen the capacity of relevant actors to use these products directly for the health programs that matter most, be it flood preparedness or air quality management. But we'll be able, through the creation of these collaborative spaces for dialogue, the partnerships, these regional mechanisms where information about opportunities are flowing, are going to create new opportunities for the health sector to be able to do better risk assessments, to be able to strengthen national surveillance systems to monitor risk, and undertake a whole suite of activities that will build system resilience. Just to end with one of the activities I mentioned that may be of interest to the network is that in the next few months we will be releasing a publication of 45 different climate services for health, which are showcasing how climate information is being used to address risks to food and waterborne diseases, extreme weather events, vector-borne diseases, heat and cold stress, poor air quality, a whole gamut of different applications, solutions that are being sought jointly together by health partners and meteorological and climate partners to build customized climate information and services. So I will leave it there, and thank you again for inviting me to join this seminar.
Now we move on to the next presentation, the next speaker, and that is Dr. Anna Espinosa from WMO, Geneva. Dr. Anna is Scientific Officer at World Climate Applications and Services Division at the Climate and Water Department at the World Meteorological Organization. A major highlight of her work is to facilitate fostering the production and effective application of climate information and products for the benefit of society and the provision of climate services. She, inter alia, provides technical guidance and facilitates the implementation of regional climate outlook forums, as well as the national climate outlook forums. And she also assists with the implementation and designation processes of regional climate centers. So Dr. Anna, over to you.
Thank you. So, good morning, everybody. Sorry for there was some technical problem. As I was introduced, I'm Anna Espinosa, working in the World Meteorological Organization in World Climate Application and Services Division. And I was very pleased to be invited to this important webinar, and I'm also very, very happy to hear about the TERI activities. And there was an excellent presentation from my colleague Joy about climate services and about opportunities given to sectors to use climate services in support of decision making, and particularly health sector. So just recalling the definition of the term of climate services, it refers to the delivery of climate information and prediction from scientific sources to end users. And climate services have value only when it's applied in decision-making process and it is used. And our goal is to make people use climate services in a real-world context. Climate information is one of the elements in the decision-making matrix. And national meteorological and hydrological organizations over many years and decades around the world have gathered data, observation data, and databases of information. And now these med services and partners have a great potential to exploit these databases to provide effective climate services. Predictions of climate variability over the next season or two or even more, which is called seasonal to interannual forecasts, are of immediate relevance to decision-making process. The World Meteorological Organization, through one of its programs, which is called World Climate Program, coordinates and facilitates enhancement of climate services with adequate focus on user interaction in order to facilitate useful application of climate information to deliver optimal socioeconomic benefits, and thereby it's underpinning the implementation of a global framework for climate services, which you heard a couple of minutes ago from Joy about that. World Climate Services Program is one of the components of World Climate Program, and it contributes to improving availability and access to reliable climate information, methods, tools, and systems through interdisciplinary activities. World Climate Services Program has put in place a number of appropriate institutional mechanisms to generate, exchange and disseminate quality information at global, regional and national level on operational basis. Such mechanisms include regional climate centers, regional climate outlook forums, national climate outlook forums, climate watch system, and so on. There are many these kind of mechanisms. In today's my presentation, I will focus on regional climate outlook forums and briefly tell about climate watch system, which is has relevance to our topic. So, regional climate outlook forums originated, have pioneered in Africa. And were established in October 1996, so it has 20 years of history. It was established at the workshop on reducing climate related vulnerability in Southern Africa, which was held in Victoria Falls in Zimbabwe. Furthermore, ARCOPS gained momentum as a regional response to the major 1997-1998 El Nino event, and since then ARCOPS have spread worldwide. WMO, through our program and a number of national meteorological and hydrological services, and also national and international partners and organizations like Meteo France, USAID, World Bank, UK Met Office, NOAA, IRI, etc., continuously support ARCOF growth and expansion. Just to briefly explain what is ARCOF. ARCOF provides platform for climate experts and climate information users, enabling them to discuss current status of global and regional climate, exchange views on scientific development of climate prediction, develop consensus-based regional climate outlooks, which can feed into national climate outlook products produced by national meteorological and hydrological services. So important aspect of ARCOF is that these forums facilitate dialogue between climate providers and users. There are different applications of ARCOF products. So ARCOF process, first of all, facilitates better understanding of the links between climate system and the socio-economic activities. An increasing demand for climate services has been recorded in many parts of the world as a result of these developments, and awareness has been created that climate information, including short-range climate prediction, is an essential element in dealing with the impacts of climate variations. ARCOFs have fostered interaction and exchange of information between climate scientists and users of climate information. So most importantly, they have facilitated the mainstreaming of regional cooperation and networking, and effectively demonstrated immense mutual benefit from sharing of information and experience. Regional climate outlook fora have made a significant contribution to the improvement of quality of seasonal rainfall outlook, as well as its communication to users. Close interaction between providers and users of climate information and prediction products have enhanced feedback from the users to climate scientists, and such interactions have fostered development of many user-specific tailored products. And so the Regional Climate Outlook Forum process has several steps, which starts with pre-forum, so-called pre-forum training part, which brings climate experts, and they are being trained by international experts and resource persons how to produce and how to downscale climate information produced by global centers to regional and national scales. Then it goes to the forum, the proper forum, which facilitates discussion on the current status of the climate and the climate drivers. This is also among climate experts. The last day of the session is the interaction of climate experts with different users. And here, these users are being explained on how to interpret the climate outlooks produced by the forum, and how to implement these outlooks in a decision-making process. The further these products are taken back by national experts, and they are disseminated at national level to national experts, national sector representatives. You can see on this map that ARCOFs have spread worldwide, and currently there are more than 20 ARCOFs existing in different parts of the world. Annually, about 30 to 40 sessions are being conducted in different parts of the world. For South Asia, I would just mention about South Asian Climate Outlook Forum, which was established in a meeting of permanent representatives of South Asian countries with WMO that was held in Italy in 2009. Countries participated in SASCOF, so-called South Asian Climate Outlook Forum, are Afghanistan, Bangladesh, Bhutan, India, Maldives, Myanmar, Nepal, Pakistan, and Sri Lanka. As it was agreed at this inception meeting, Indian Meteorological Department coordinates the operation of SASCOF, and it hosted the first 3 forums. And we are going to have the next SASCOF session from 19 to 28 April in Sri Lanka. And the interesting feature of this SASCOF, it will have also climate services user forums. One is focused on water, and the other one is focused on health. So just to mention also another example of relating ARCOF products with health. As we all know, many diseases are associated with directly or indirectly with climate. Vector-borne diseases are sensitive to change of meteorological parameters such as rainfall, temperature, wind, humidity, etc. And this includes malaria, dengue, and Rift Valley fever. Extreme climate events can trigger rampant outbreak of waterborne diseases such as cholera, typhoid in areas where they are not common. Some efforts are being made to produce warning of changes in epidemic risk by integrating rainfall, temperature, and other non-climate information. For example, malaria climate outlook forums, which have been held in association with ARCOFs in Southern Africa and Greater Horn of Africa. Information developed jointly by climate and health experts in these sessions, together with information on population vulnerability, food security, immunosuppression, and adequacy of control coverage, gives the health community longer lead time, over which they will be able to optimize allocation of the resources available to combat this disease. And I will say also a few words about Climate Watch system. For more than a decade, WMO and National Meteorological and Hydrological Services focus on setting up this effective Climate Watch system to improve risk management capabilities of national institutions facing climate extremes. Climate Watch is a system consisting of a set of functions and responsibilities, providing information on the status of climate and the possible negative impacts induced by evolving climate anomalies and extremes. WMO Climate Watch systems are designed to provide advice and statements to inform users, particularly those which are involved in national hazard preparedness, mitigation, and response, about evolving of foreseen climate anomalies at the regional and national levels. National meteorological and hydrological services should be therefore adequately equipped and prepared to continuously monitor and assess the state of climate, access and evaluate available long-range forecasts, and where the conditions are warranted, provide to end users concise and understandable climate early warning information at different time scales, starting from 10 days to weekly to monthly and seasonal time scales. Climate watch advisories are being used by NIEHS to their users, and they're issued by meteorological services. Climate watch system doesn't imply or require creation of new entities or new centers, and it's using all available climate information on observation of current conditions and weekly, monthly, seasonal monitoring products, and also forecasts which are produced by global, regional, national institutions. At the regional scale, regional climate centers provide climate watch advisories, assisting national meteorological and hydrological services at developing national climate watch. So just to conclude my presentation, as I mentioned, the World Climate Program through one of its components, the World Climate Services Program, will continue to promote the development of climate services with active participation of application sectors, and networking between climate information providers, research, and other agencies and stakeholders is essential in this process, and we need to leverage climate information to exploit opportunities afforded by climate, as well as to manage the risks associated with adverse climate situations. Thank you very much for your attention, and if you have any questions, you can contact me at my email address. Thank you.
Thank you. And now that we've concluded the presentations from WHO and WMO, we will now move to the presentations at the national level in India. And to just give the opening remarks, I would request Air Vice Marshal Dr. Ajit Tyagi, former Director General of the IMD, who is with us here. And we're very grateful to you, sir, for starting the ball rolling on the early warning systems in the Indian context, early warning systems for health.
Thank you, Nitish, for inviting me for this webinar, which is being organized by NIH, TARU, and TERI. Very good initiative of building the bridge between the climate and public health. I'm happy to listen to the two presentations made by colleagues from WMO. In fact, being an active player in the formulation of global framework climate services as a member of EC task team, I'm very happy to see the progress being made, but still we have to go miles, particularly in the developing countries, where the impact of climate on various health issues, as mentioned here, the heat, vector-borne disease, waterborne diseases, famine, extreme weather events is felt to a large degree. And just to mention that last year in South Asia, we had both in India and Pakistan about 5,000 deaths because of heat stress and heat waves, more than any other single weather event. And the early warning of these particular phenomena can be provided by the National Met Services. Idea is, how do we link? And towards this, there is an initiative which was started at Ahmedabad by IPH, of which Professor Mavlankar is going to make a presentation, is noteworthy. And this is being extended to 4 cities in Vidarbha and in Odisha, 5 cities this year. This is what the partnership really means, that the early warnings which the Met Services can provide, how the health sector starts using it. And in many more areas, we need to understand what are the requirements of the health sector and what the National Met Services can provide. Towards this, the capacity building both of the health sector and the meteorological services and partnership is very much essential. And towards this, initiative of TERI, TARU, and the NIH is most welcome, and we look forward many more such interactions between climate services provided by the National Met Services and the health sector and the NGOs, which are going to play a very important role in awareness among the public, how to use these climate information. And of course, the support from the WMO and WHO on technical matters and capacity building is most welcome and very much required. So I wish this initiative a great success and needs to be followed up. One webinar is not sufficient. We have to bring in more partners and more activities are required. Thank you very much. I'm really happy to be here and see the progress being made.
Thank you very much, sir. And now I'd like to introduce, we have a polling that will be on. You just have 30 seconds to answer it. So it's a very simple question. And while you answer that, let me introduce you to our next panelist, Professor Dilip Mamlankar, and his topic is on the heat health early warning system in the Ahmedabad Heat Action Plan. Professor Dilip Mamlankar has been heading the Indian Institute of Public Health, Gandhinagar, as the director since 2012. His work experience includes faculty and research positions in NHL, Municipal Medical College, Ahmedabad, NIEHS, Bethesda, USA, IIM, Ahmedabad, Mailman School of Public Health, Columbia University, New York, and he's also worked as a consultant to many agencies, including Columbia University, WHO, UNICEF, DANIDA, UNDP, World Bank, etc. He has authored several publications and has been advisor to key academic institutes, government and non-governmental organizations. So with that, over to you, Professor Mamlankar.
Thank you very much. I hope all of you can hear me and maybe see in a minute. First of all, let me congratulate TERI, TARU, and NIEHS of thinking of this webinar on building bridges between climate and public health. And we had excellent presentations from Dr. Joy and Dr. Anna about setting up of the global framework and how climate services can be used in public health matters and other matters of agriculture, water, etc. What I am going to present in the next 10 minutes is a concrete example of what we have been doing in the city of Ahmedabad in Western India over last 4 years. What we have developed is what we call as Ahmedabad Heat Action Plan. And as the slides come up, I'll explain a bit about that. The idea came as a partnership developed between the Indian partners and US partners through a national consultation we had in 2011 on heat health in Gandhinagar in Gujarat. This was supported by Indo-US Science and Technology Forum. Okay, so what I'm going to talk about is heat health early warning system in Ahmedabad. As you know, India is already a very hot country, and that is why heat is not really taken very seriously by people till very recently, when in 2015, more than 2,000 people died in the summer during the heat waves in whole of India, and there was a lot of media coverage. If you start looking at the temperatures in Ahmedabad, when we did this analysis between 1980 and 2012, already the average summer temperatures, daily temperatures have started to rise. And this is even felt by the people of Ahmedabad who lived in Ahmedabad for a long time. Remember that winters used to be quite cold and we used to require a lot of sweaters and blankets. Now hardly there is 1 week in winter which in Ahmedabad we need sweaters. So even just past 30 years, the temperature seems to be increasing quite rapidly. Ahmedabad is a city with about 6 million people located in the western province of Gujarat. As I was mentioning, we started with a scientific workshop in 2011, where we brought 40 scientists across the globe and from India, from the health side, from meteorology side, from public health, clinical sciences, and public administrators, and understood how globally heat-related health work is happening and how people have developed heat-related action plans globally. With that workshop, we developed a partnership through a formal structured MOUs between our institute, Indian Institute of Public Health at Gandhinagar, and Public Health Foundation, Natural Resources Defense Council, which is an American NGO, environmental NGO, and US universities, Emory University and Georgia Tech. And that was then extended to Mount Sinai Hospital in New York, then recently India Meteorology Department and Ahmedabad Municipal Corporation. With this partnership, we started studying what had happened in Ahmedabad in 2010. There was a major heat wave on 21st of May 2010. If you see the graph, the red line on the top is the temperature, daily temperature of May 2010. And the blue-black line at the bottom is the temperature, daily maximum temperature average of 2009 and 2011. So what it is clear is 2010 was little bit hotter to begin with in May, and 21st May, the temperature peaked to 47 degrees and then gradually came down. Now with this, we correlated the data from the Registrar of Birth and Death in Ahmedabad. Ahmedabad has a good municipal birth and death registration system, and upwards of 95% of deaths are registered. So this next graph shows you that Ahmedabad, on an average, at about 100 deaths, all-cause deaths, total number of deaths every day in the month of May. But if you look at the bars, which show the daily mortality or death counts of Ahmedabad for 2010, they were slightly above the average in the early parts of the May, but starting with 19th of May, the graphs rapidly climbs and reached a peak of 310 deaths recorded in the city, and then gradually falling to the normal till about 31st of May. Now, if you take both these previous graphs and put together, we correlated them to produce this graph, which shows that the peak in mortality exactly overlaps the peak in temperature. And if you add up the total excess deaths in Ahmedabad, just in the heat wave peak, which is from 19th of May 2010 to 27th of May, there are roughly 800 additional deaths just in 1 week. So it clearly showed to the Ahmedabad Municipal Corporation, to the government, and to other stakeholders that even in a hot city like Ahmedabad, when the temperature rises above certain limit, there is lot of excess mortality. Now, taking this facts into account, we also did small studies of which are the vulnerable population in Ahmedabad, and then developed what we call as Ahmedabad Heat Action Plan from 2013 onwards. It was a collaborative effort between Indian Institute of Public Health, Gandhinagar, NRDC, and Ahmedabad Municipal Corporation, along with Georgia Tech and Emory University, which were other partners. This heat action plan, the cover of which you see on the slide, was developed based on review of heat action plans in Europe and in North America. And we looked at the Ahmedabad data of 2010 heat waves, had series of meetings, workshops with the stakeholders, and identified what are the possible actions which the citizens and the local government can take to avoid this morbidity and mortality due to heat waves. And this plan was then written and disseminated through internet and printed versions and through series of meetings and workshops and trainings of various stakeholders, including people working in hot conditions, doctors and nurses, ambulance system and health systems, and public administrators. Now, using the data which we had in Ahmedabad and analyzing and correlating with mortality, we came up with a 3-level alert system. The temperatures, maximum temperature between 41 degrees to 42.9 degrees was called yellow alert, where there is slight increase in mortality. From 43 to 49.5, orange alert, where there is substantial increase in mortality, and upwards of 45 degrees centigrade, extreme heat alert day, which is red alert. So this was simple enough to understand for people that they could follow, and our partners from Georgia Tech and now from IMD give us a 5 to 7 day early forecast of what is the likely temperature going to be there in Ahmedabad, starting from 1st of April to 30th of June every day. And that is then conveyed. If the temperature is going to reach alert levels, then that is conveyed to the people through various media and other methods. Using this plan, the nodal officer of the municipal corporation, a deputy health officer of health, was identified as a nodal officer, and the nodal officer received the alert, the weather and forecast information, and decided based on the cutoffs and actions, and alerted by email, phone, fax, and other ways the media and different departments of the municipal corporation, the local power utility, the water board, the school board, etc., to take various actions. So this flow chart gives you on the right-hand side of the slide how the alerts are passed on to various users and people who can take action. On the left-hand side, I'm just showing how we got the alert from Georgia Tech every day evening for the next 7 days, maximum temperature, which is likely to happen, and what is the probability with which it will cross the alert levels of extremely hot or very hot or hot days. So this became our, in some sense, climate service, which provided the alert, and the municipal government alerted the citizens and various departments of municipal corporations. This was started in 2013 on pilot basis, and then we improved on this system in 2014 summer and 2015 summer. What I just want to show you in this slide is the distribution of days with maximum temperature above 42 degrees, because that is where the mortality starts rising. So the blue bars show you the 2010 temperatures. Even though it reached 47 degrees on one day, most of the days were at 43 degrees. But as we move to 2014 and 15, what we are seeing is it didn't reach 47 degrees, but the temperatures at 44 and 45 are much higher number of days than 2010. So what we have seen over the last 5 years is summers are becoming hotter, with more days with 45 degrees and even 46 degrees. And in some sense, these 2 years, our heat action plan got tested to see what is the impact. We continuously monitor the mortality during summer months and compare them with previous years. What we see is in Ahmedabad, the daily mortality peaks on the days where temperature is more than 43 degrees has reduced after the heat action plan by about 30 to 50% as compared to the 2010 heat wave year. The number of reported cases of heat stroke, 5 hospitals in the city are reporting heat stroke cases to the municipal authority, that is also reduced by about 75% as compared to 2010 to 2014-15. And now with this information, we had approached the India Meteorology Department, as well as we organized in the summer of 2015 a workshop and called various cities and states to learn from Ahmedabad experience. And we are very happy to note that the Maharashtra government, neighboring state, which has even hotter areas than Ahmedabad, especially Nagpur and central India, which is called Vidarbha, is quite hot. They have taken up from this year to develop and launch their heat action plan. And similarly, Orissa State Disaster Management Authorities and Orissa Health Department with Indian Institute of Public Health in Bhubaneswar are launching today the Orissa Heat Action Plan for several cities in Orissa. So in some sense, the efforts which we started 3-4 years ago in Ahmedabad are now gradually spreading to hotter areas of India, and they are adapting this plan and modifying and implementing in their own cities. To end, I want to just emphasize key lessons from this Ahmedabad Heat Action Plan. I think the first lesson is heat action plans at city level are very much doable even within resource-constrained settings such as India, if people get together from the weather service and from local municipal health departments. What it needs is data on temperature, so good temperature prediction systems and past temperature records, which are generally available with the Met Office, and daily mortality or morbidity or ambulance-related call data to correlate with the temperature to determine appropriate cutoff thresholds for issuing warning for people and the government machinery. It is better to have 5 to 7 day advance predictions, which now Indian Meteorology Department is kindly started providing and is willing to extend not only to some cities but throughout India probably this summer. What we really need is local leadership of the city government, the technical inputs from academic institutions like the public health institutions or a medical college, as well as involvement of other stakeholders, general administrators, the municipal commissioners, the divisional commissioners, and even the chief secretary or the secretaries of the state to take this action forward. Lastly, as epidemiologists and public health people, we want to see the results in terms of reduced morbidity and mortality. So we must keep watch and monitor the total number of deaths, the heat-related deaths, and heat-related hospital admissions, etc., to see whether the actions taken are really resulting into reduced morbidity and mortality, and then continuously modify the plans. Finally, I want to thank all of you by showing you this image where we last year got all the city key bureaucrats as well as elected representatives, including the deputy mayor of the city, the municipal corporation, and the technical department, as well as our partners, NRDC, on one forum to launch the heat action plan of the city, which also emphasizes the need of all stakeholders to work together to develop and launch such plans in other cities. Thank you.